When I look in the mirror, I see someone that I don't recognize anymore. I guess it's because I'm aging and I don't like it. But I do work out 5 times a week. I do cardio 5 times a week, and I work out on the weights 3 times a week. My thing is that I work out so hard on my body to keep fit and to be healthy and to live a long life. Why can't I get plastic surgery and have my face sort of match that? My family members think that I should grow old gracefully.
She keeps telling me about her face. She said, "Oh, I look ugly," but I don't. I don't think so. I told her, "No, you're not."
It's a cultural phenomenon. In other words, the things that people focus on in terms of what's important in body image or how they think their body should look is very much influenced by where they live, the time they live in, and also exposure to things like the media. It's been called body dissatisfaction, it's been called the normative discontent, meaning it's normal to feel discontented about your body, particularly for women and girls. But I think mainly people are unhappy with some element of their body or their face or themselves, the way their physical appearance is, and they feel that it's fixable with surgery.
I have a really good friend who's had a facelift done, other things as well, and we were chatting. And she sent me pictures of 20 years ago, and she looks better now than 20 years ago. And I thought, God, she looks so amazing. So she said, "Oh, I think you just need some fillers in your face, like some fat injections. They're doing that now." So I asked her who did it, and she said Dr. Waslin. And so I went down to see Waslin with just the idea of getting the fillers done.
What concerns do you have?
Well, I would like you to lift me up,
Okay.
and I would like you to inject some fat in here so I'm rounder. And once I'm down there, he looks at me and says, he measures and everything, and he said, "Well, this is what I'd like to do to you." And he pulls my face a few different places and says a few different things.
That's man-made. It has a certain mathematical relationship to it to make it look perfect. And that relationship is called the golden ratio. My name is Dr. Greg Waslin. I'm a plastic surgeon. I've been practicing in Calgary for the past 25 years.
What about this?
Yeah, well, and we'll put a little fat in there to make that better so that's not so strong. And of course, the concept that plastic surgeons use today is not mere guesswork. It's not going and somebody saying, "Oh, we should do this to you, we should do that to you." It's actually more than that. We're based on science. We want patients to have a scientific examination, and that's where the golden ratio comes in, because everything in nature, whether it's a man-made or made by nature, has a certain mathematical relationship to it to make it look beautiful, whether it's a flower or whether it's a human face. I think anybody's a good candidate as long as they have realistic expectations and they want to improve themselves. And so often they're telling me what they want, and as a professional, I'm giving them advice as to whether they're correct or whether it's possible or whether it's safe to do what they're requesting. So it's going to be more like that.
Not bad for my age, though, right?
Very good for your age. I think most people are well informed today. The reason is because we have the internet. Certainly in the last 5 to 10 years, I find patients much more informed than they were before. They've seen pictures, they've seen photographs, they have an idea of what they want. Well, Catalina is going to have a procedure where we're going to tighten her skin. So she's going to have a mini facelift. She's also going to have an upper blepharoplasty. She's going to have some filler techniques using her own fat as a filler. So we're going to add some fullness in here for you, and we're going to steal a little bit extra fat that you have stored here for us, and we're going to put it in your cheeks to make that fuller. So when we do the surgery, not only are we going to make your skin tighter, but we're going to actually fill it so it's more like it was when you were 35 and 40.
Great.
Okay. She's youthful in appearance, and she has, some of the aging that normally takes place on all of us. with time. And so she has the deformities of loose skin, of some deflation, some deterioration of the skin. And so those are the things that we can improve.
I haven't really talked to a lot of people, just a couple of good friends. They think, why not? Go for it. My family would say, you're an idiot. I'm looking forward to the end result. Can't wait, actually. I'm about to go into surgery and I'm really excited about it. I'm looking forward to having the sag gone from my face and having it a little bit fuller. Yeah, I'm looking forward to looking better.
Taking fat, harvesting it and re-injecting it as a filler is a technique that's relatively new. These are the markings that we use for our facelift surgery, and these are where the scars are going to be. So plastic surgeons tend to cut along the dotted lines, so that makes it easier for us. Of course, the important part is to put the lines in the right position. So that's where the experience and technique comes in. Where we're going to put the fat is we're going to put the fat in these hollow areas, and you can see that she has a hollow area here, 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 and we're going to add a little fat to her cheeks because her cheeks have lost fat, and this is where the cheekbone is.
Don't do that, it hurts.
Okay.
It hurts.
So we're making the skin incisions for the cheek and neck lift, and we're going to make sure that these lines fall into really tight normal skin crease lines so that the scars are invisible.
I feel tired and I'm frozen. On the left side, I'm frozen of my mouth.
Do you have any pain at all?
Just a bit of a headache. No pain.
Did you feel anything at all during the procedure?
No, I felt weird things. Like, I felt like they had a clip and they were clipping back and forth on either side of my face with something cold.
I've been in health and fitness for over half my life now. I weight lift and do cardio 6 days a week. I eat very healthy foods. After having 5 children, there is nothing else that I could possibly do with my body that was going to change the way it looked. I had my first plastic surgery 12 years ago after I'd had my second son. I had a breast lift done first, and then after the breast lift, because I wasn't happy with the results, we did a breast augmentation. I ended up having very small breasts after having 2 surgeries done. We originally did the breast augmentation, which still left my breasts fallen, and then the surgeon had decided to do a lift after that.
One of the most common is liposuction, and the second most common is breast augmentation, and then followed by facial rejuvenation techniques like facelifts and blepharoplasties and injection techniques.
When you pay that kind of money and you come out of plastic surgery and you see what other people's results are, and you are hoping that that's at the end of the day what you're going to look like, and you don't, I found that difficult to deal with.
often today when there's lots of competition for this aesthetic type of practice, certainly things can be done poorly, and those patients have to just wait and allow things to settle down before they should have any type of plastic surgery. I think it's important that patients seek more than one opinion. I think they should seek at least 2 or 3 opinions. I'm not sure the internet's the best place to make your decisions.
All of the images that we are exposed to virtually, like on television, movies, advertisements, they're all portraying these people who look a certain way, typically thin, but with curves in the right places if you're female, you know, with lots of bulging muscles if you're male. And then people look at themselves and they see a mismatch. I believe it's a reflection of the dissatisfaction they have with their body and a willingness to sort of go to great lengths to achieve perfection or achieve something closer to perfection. It's sort of understandable that women in particular who are judged very much on their appearance would go to great lengths to try to hang on to that, because it's sort of like power. Research has shown that people who get plastic surgery are, on average, happier than those who haven't. But 1 year after surgery, most people who have had surgery, as opposed to not having had it so far, or maybe electing not to do it, that they're happier with how they look, at least somewhat. So I don't think it's a miraculous cure where everyone is just so beyond thrilled with no matter what, but on average, people are happy. However, people who have body dysmorphic disorder are not happier.
It was one of the most painful things I've ever done, having that tummy tuck. There was quite a bit of swelling, which was very disheartening. I think in our minds, we feel like we're going to have this plastic surgery and then just look in the mirror the next day and look a certain way. When I came home from the hospital, I could barely walk up a set of stairs, which is definitely something I'm not used to, as I'm very active and a mother of 5 children. I actually had to take time off of work, which I've never done before.
Certainly some patients have a more rapid recovery than others. Sometimes age has something to do with it. Certainly younger patients will tend to recover much more quickly than older patients. Sometimes the type of surgery is also an indicator of recovery. So it is a bit of an individual thing based on patients and based on techniques and procedures. I think this is something they're doing to themselves, and they want to have a good result and not have some disaster occur that they regret, because that can certainly happen.
The scar is fairly large, but it's very low and easy to cover up, and I absolutely love the way I look now. I did it only for me, nobody else. I wanted to feel beautiful on the outside as well as on the inside, and it was something that had always bothered me. I don't think I would have any more plastic surgery. I'm extremely happy with the result, and really there's nothing else on my body that I would want to change. I would never have any plastic surgery on my face. I definitely draw the line there because it's fear-based. I would be afraid of the scars on my face or the result in something not turning out the way that I had wanted it to look.
Well, it's been a week since surgery, and they're taking some stitches out. No, I don't remember anything. I just remember dreaming about my dog, Bella. That's about it. I haven't experienced that much pain, just really uncomfortableness, like really tight. And, you know, it's hard to sleep. I sleep a lot during the day, and it's amazing how much energy you have to expend to get up and go to the bathroom and get something to eat and something to drink and let the dogs out and let the dogs back in and, you know, feed them and answer the phone.
You haven't had anyone at home
No, I haven't.
to help you this week, though, have you?
No, I haven't, no.
She'll be her best in about 2 months, although she should be able to go to Safeway and Starbucks at 2 weeks and look good. Although to her relatives and friends, they might suspect something at 2 weeks, but certainly at 2 months it will be all well within normal.
Come on, baby. Come. It's been 6.5 months since I've had surgery. And the recovery was kind of difficult, I must admit. And once, the initial first few weeks were over, then it was okay, right? And then the bruising and everything, the bruising was, I'd look in the mirror and I'd think, oh my God, what have I done? I'm having laser surgery because I have old skin and I have suffered with acne most of my life as well. And I have marks on my skin. If you can see them, you probably can. Yeah, that's why I'm having it done. This is the last thing. I'm petrified about having it done, I'll be honest with you. I'm afraid of the pain. I don't know what's going to happen. I've heard horror stories, but all my friends have said to me that, yeah, I'll be fine.
It feels like a light sunburn, basically, like a first-degree sunburn that you might get if you went to the mountains for the first time in the spring or didn't use sunscreen. It's like that. Basically, the loose skin, and we corrected that with a face and neck lift. And today we're going to do the second stage, which is going to correct the skin quality, increasing the collagen with laser resurfacing, and we are also going to improve her facial fullness by giving her some fat injection or fillers. It is quite invasive, and it's basically taking off the superficial layer of skin. It's really a burn. It's a superficial burn. So because I'm a plastic surgeon who look after burns, it's easy for me to do that for her. And so it'll take a week to heal, and after that she'll be a little pink for a few weeks, but her skin will in fact be brand new.
The initial part of it is that you're shocked. You're like, what did I do to myself? You look in the mirror and you're like, oh my God, what have I done? But on a daily basis it gets better. I didn't feel anything while I was under, but afterwards, like the day of, because I came home in the afternoon, it wasn't too bad because I think I was still frozen. But especially for the next 3 days following, I felt so hot and the pain was terrible. And it was blistering, like I blistered everywhere and it was running down my face, and I would think, the third day was the worst. The best thing to do is not look in the mirror. I'll be honest, it was painful. Both surgeries were painful, and afterwards it was painful. But I did get good medication from Dr. Waslin. He knew what kind of medication I wanted and what I couldn't take. So that really helped a lot. I'm glad it's over. I'm glad I did it. I'm really happy with the final result. I really am.
There's a huge premium placed on youth in our culture and our society too, so that people, especially women, who when they age become less desirable, less attractive, and that's not desirable. That's a bad thing. So cosmetic surgery gives gives people the option to try to look differently than other people in their age bracket, and be more desirable, I guess, and more attractive. So maybe to feel good about themselves, but maybe also about how they look to others, because clearly they're not the only ones looking at themselves.
Men tell me how gorgeous I am and stuff like that, which they kind of sort of did before, but not to the extent now. Women, I think, are mainly jealous. I went out to my friend's town where she lives, and they were pretty catty after I left. No, I'm sure she's had something done, and I think women are jealous, I just turned 64, and seriously, I don't feel a day over 50. Maybe even less. despite all the pain and all the anxiety and all the turmoil that I feel I went through, it was just so worth it. It was really worth it. Yes, I would do it again.